Hi, all. Thanks so much for joining Making Healthcare Work for You, Different Perspectives and Empowering Solutions. I'm Stephanie Fields, joined by my co-host, Dr. Apoorv Gupta, and we are welcomed by Dr. Graham Gardner, who is the co-founder and CEO of Kyruus. Thanks so much for being here.
My pleasure. Thanks for having me.
I would love to start off with your transition of how you went from practicing cardiology to founding Kyruus and why. What is the motivation behind that? Because it seems like it's very rooted in patient equity and access.
Yeah, happy to. So I've always been drawn to impact and being able to make a difference in the world. And cardiology obviously offers you an incredible opportunity and the privilege to take care of folks, but also to interact with really cutting edge technology, which was also an interest of mine. So I very much enjoyed it. But as I watched my father, first of all, work in the pharmaceutical industry and understand that doctors did other things with their lives, and then actually become an entrepreneur quite late in life, that really became a light bulb moment for me that I could not only take the technical training I had, but also all these ideas running around in my head and have a different kind of impact in a different kind of scale. And so as we were starting Kyruus, one of the contexts here was having practiced medicine and having seen patients come in and see the wrong provider. And as medicine was getting increasingly subspecialized, you think about orthopedics now, there are hand specialists on elbow and shoulder and foot and ankle and hip and knee and spine. And hospitals were getting larger and larger, and providers no longer kind of knew each other. Too often, patients were coming in and seeing the wrong provider. And that was a frustrating experience for everybody, and also contributed to suboptimal care as well. And so having that as context, I saw the movie Moneyball, which you may be familiar with from the sport of baseball, but it really resonated with the worldview that I was raised with, which is that we're all different. We're all beautiful in our own way. We all have our relative strengths and weaknesses. And I realized that providers, like baseball players, all had unique gifts and strengths. And if we could begin to understand those characteristics and match them with the right person, a lot of great downstream things would come from making that match correctly. So that became the founding vision for Kyruus. Today, we're fortunate to work with hundreds of organizations across provider organizations, payers, the government, digital health companies, providing all the right information and all the right workflows for people to find and then schedule the care that they need.
That's really interesting, Graham. So some of our viewers who are avid fans of ours may remember that we already interviewed one of your executives, Karen Conley. But just briefly, for those who may not be familiar, can you just describe a little bit of how this works when you start working with a client? Exactly how do you figure out all these unique strengths of the providers, and then how do you make that accessible?
Yeah. So the work starts with basically building a digital inventory of who does what, where, when across the network. And what we find when we work with organizations is that the information we need, we're generally collecting for about 100 different data elements about each provider: name, rank, serial number, the picture, the web bio, the locations, the insurances they take, the conditions they treat. That information sits in dozens of different silos, and it's all labeled differently. So my picture might be in a marketing database labeled gardner.jpg. My specialty is a credentialing system labeled Graham S. Gardner, MD. We have to make sure at scale across thousands of doctors and hundreds of different data elements, we're pulling all of that together and building the right profile. The next step then is enriching that information. And I think one of the things I'm most proud and excited about there is a clinical library that we've developed over the last decade that describes every condition, procedure, symptom in every abbreviation and misspelling and lay term. And that is a real opportunity to think about health equity, because if you think of diabetes as the sugars or sugar blood, you can type that in and we can get you to a diabetologist without you having to know that fancy name. And so it's translated into Spanish. And so again, as we think about serving everyone, you have to be able to meet patients where they are and then be able to draw them accurately into the system. And that begins to really allow very precise routing. So that now when you search for a carpal tunnel, we can truly get you to a hand surgeon and not one of those knee surgeons. You're optimizing the provider's time, you're ensuring the patient's getting to the right provider. And also from a system and a health plan perspective, you're reducing waste. You're not causing patients to have to come back in and pay additional co-pays as well. And you're able to process more patients with the existing inventory that you have as well. The other part of the technical backend curve is actually integrating directly into all the EMRs as well, so you can provide real-time availability and real-time booking. So the same way that you and I go to Travelocity today, we can search across all the different providers of seats and sort and filter by what's important to us and book one. You can do the same thing across all the EMRs, choosing what preferences are important to you and book an appointment there as well. So that's the digital inventory on the provider side. We also incorporate imaging labs, retail clinics, virtual care options as well. So there's really a very rich inventory of care destinations that you can route someone to. We publish that information then into an application layer, and that can sit at a health system. So it can be in their call centers, their websites, their referring provider networks, but increasingly now also publishing that beyond those walls out into the regional health plans. So now someone can search and book care directly from a local health plan into those providers, all the way out to Google and other digital health companies. So again, wherever someone starts their search for care, we can be there with accurate information and the ability to route them correctly into the right destination for their care.
It's interesting, when you were talking to us before, you said several times a couple different things. You said that your mission is really to meet people where they start their journey, which resonated on two different levels, because you said that it literally where they start their journey of, okay, are we starting on Google? Are we starting on my health insurance company's website to search for a doctor? Or you said that a lot of times that access part comes into play where people don't know who they're supposed to see. So they might type in the sugars, but then you said that there's been a tremendous amount of people searching for different transgender related issues. So that's a different type of journey, but in either case, you're able to serve both of them. And you said that Kyruus wants to be like the plumbing, and just the background that it's operating, and you don't really notice it unless it's not working, then it's a problem. And so it's pretty neat that you're able to do that. And, you think of plumbing systems and how they, are in the background and, weaving in different ways, which is kind of how your system works with all these different things. So tying in one other element that you told us, you went to Brown Medical School, like a Porv, and you guys both shared a similar story about the touchy-feely end of things, which you said you weren't sure about in school, but then you had a particular moment in your practice where that really came to light. So how do all three of those merge together, where you're able to say, I've had this, I remember this in school, I learned these things, but then I had this experience that really resonated with me in my practice. And then seeing that you originally started Kyruus for the intent of helping people get to the right provider and be able to schedule easier, but then seeing that it's having this other back, through the plumbing, all the winding ways, that you're then having these residual effects on people in the big ways, having conversations that they might not be able to have on their own, but they're able to start this journey. So it's a very long-winded way of asking how those three have intersected, because it's pretty powerful.
I'll do my best to try to weave it together. Maybe I'll start off with the patient story, because it's as I was mentioning to a Perv, it is something that has stuck with me my entire life. When you're going through medical school, I think there's a bias to focus on the science classes, right? You think you've got to learn all these drug names, you have to study anatomy and understand where every artery and vein goes. But Brown, it was a very humanistic, very progressive, and culturally attuned school, and so we were also, being taught how to actually speak with patients, and how to respect them, how to really draw them in and understand who they were as a human being, so you could really deliver holistic care. But we too often were dismissive of that class. We were focused again on kind of the hard sciences. So fast forward probably, I guess, 11 years, those 4 years of medical school, 7 years of clinical training in cardiology. And I remember, I can tell you what floor I was on in the hospital and what corner of the room, having a conversation with the family about whether to withdraw care from someone through a translator. And at that point, 11 years later, every medicine I wrote for had been invented after I left medical school. And I really only cared about very limited anatomy, a couple arteries around the heart. And what was vital in that moment was to connect with a family through an interpreter. And I knew to focus on them, not the interpreter, and help make that very difficult decision, hopefully a little bit better for them. And I think what it highlighted for me, again, was the power of when you can bring the right two people together, right? Someone who's been training for something all along, who can make someone comfortable and ease them, or hopefully treat them, through that point of care. And so I think that was really one of the moments that was born of that precise ability to route. What then, as we developed this clinical library, I had other kinds of experiences along the way. One of them was we'd spent a lot of time early on in the company thinking about specialists, right? And probably some of my bias, but also that's where a lot of the clinical routing was necessary. And so we turned our attention then to primary care doctors and how they differentiate. And I remember we developed a number of kind of thematic areas where they might want to express an interest in something. And one of them was homelessness. And I was again taken back to an encounter I had as a resident when I was way too busy, and a homeless person had come in, and embarrassingly, one of your first reactions is to, oh my gosh, this is going to put me behind for the day. I'm going to have to take care of so many things, as someone's not going to have a support system, et cetera, et cetera. And in retrospect, it's horrible, right, to think of that way. And I remember in that moment, then, as we were developing this library, being aware that someone was going to proactively sign up for that and say, you know what, this is why I went into medicine. And when that next homeless person comes in, it's because I am the right person. And just the ability for our platform to touch people in that way was incredibly exciting. And maybe the third, to kind of touch on the other issue we were talking about earlier as well, we track every search, every query. So hundreds of thousands of searches every day. You understand, is it insurance is more important? Is it location? What are the terms? And we noticed early on a difference in the search terms that were happening online versus what people were calling into a call center. And to your point, transgender surgeries and things like that, people were clearly much more comfortable typing into a website and finding their way to the right care than they were maybe talking to somebody on the phone about that. And so you're opening up access now to someone that may not have sought out care or gotten the right care as quickly as that as well. So I hope that we wove a bunch of those things together for you, Stephanie.
Amazing. I can't believe you remembered all those points. It's really tremendous. And I'm also really blown away, as Stephanie, and I'm sure is as well, at just your commitment to the patient. I mean, throughout all of this, in every story, really, the whole driver is not just another piece of technology. It's really about how each element of that technology really helps serve the patient experience. So that's just tremendous. That's the chase right now. Everybody's trying to figure out, how do we enable that kind of customer experience. You had mentioned earlier when we were speaking, Graham, about how you're trying to be that technology that just operates in the background, integrating all of these different layers, and in kind of ensuring that this experience is there, sort of akin to the Amazon type of experience, where a user can just go there and have it all integrated. So maybe you can speak a little bit more as to how exactly you're figuring out what are the different components of the elements that you need to put together, so that the end consumer has that ultimately refined experience that they need.
Yeah. So I think first of all, hopefully you're seeing that the commitment to the patient is an authentic one. It's what motivates everyone to work at Kyruus. There's a real camaraderie around the mission and the impact that we're having. I think one of the perspectives I brought into technology from the world of medicine was the fact that technology had been done to doctors for so long, right? And it actually has made their work more difficult, right? They spend a lot of time typing things in instead of being with the patient. And so we've always tried to think about, how are we actually decluttering the patient, the provider's time and technology, so they actually can lean back in to this. And I'll give you maybe one more example. This is not a provider; it was a call center agent. We were listening in. We were first deploying our technology into some of the call centers, and before Kyruus was there, people had binders and 6 different windows open and a post-it note that Dr. Jones doesn't take patients on Yankee game days. And then of course the phone's ringing out the hook, and 1 minute it's someone who's incredibly angry because they got some bill they don't understand. The next minute someone's crying because they got a cancer diagnosis and they're not sure what to do. And they would ask for something like, is there a female provider I can see? And the agent would go, oh, please hold, because now they're going to have to take down a binder and sort through, right? And that, that's not the front door you want, right? Into your organization. After we went in, it's all there, right? You have a kayak, and you can sort and filter with one click. You can bring back, female providers, and it completely changes the connection between those two human beings. They're now proactively say, hey, would you be more comfortable getting a female provider? Because I know I can now serve that and be so much more empathetic. And so, yeah, I think about that. I think about call centers across the country every day being able to be with their patient, in a way that they weren't before. Second philosophy that I think we're seeing play out a lot is, we look for instances where the patient can actually do the job better, and with a better experience for them than the health system can. So think about that scheduling. If I've got to call in, wait on hold for 20 minutes, speak with an agent, et cetera, they're paying, a lot of money for a lot of agents, versus I can go online whenever I want, search for whatever I want, and book an appointment. I actually enjoy that experience, and it actually costs the health system less. And so we've got organizations now that have shifted tens of thousands of appointments a month to the digital channel, and are in a really tight labor market where people just can't find that. That's a win-win. And so again, those are the kinds of things we look for.
We've shifted all that work to a digital workforce. We've automated a lot of this. Is it evident enough? Probably, I'm sure the answer is yes, but maybe you can help us understand, how is it evident that makes it more efficient? Because Stephanie kind of had asked this question at the outset too. Your goal is to start right where the patient is, and that patient, without the education that a physician has, or that a scheduler has, do they really know what they need? And is your system able to help lead them sufficiently so that they're not, now you've given them all the tools, but they're still plugging into the wrong physician? Because I don't know that I have carpal tunnel syndrome. All I know is I've got pain in my wrist. So
Yep.
maybe you can jump off there and help us understand.
And does it lead in? Does it have questions? Like does it prompt them, I guess, because that's a good question.
Yes.
Exactly. Yeah, no, so you're asking all the right questions. And I think one of the major themes in healthcare right now is that one company can't do it all. And so we have spent a lot of time over the years thinking about the digital stack of technologies that organizations need to weave together. There are core infrastructure things like your EMR, your CRM. We think a routing and scheduling platform like Kyruus. And then there are other things like virtual assistants and chatbots, telemedicine options, and things like that you also want to hang on together. So what that has prompted us to do the last several years was a number of partnerships with the major EMR vendors, the major CRM, telemedicine vendors as well. And where it was appropriate, and we just announced another acquisition recently, actually by companies where we actually could seamlessly put these things together. And so our recent acquisition of Epion is really thinking about that patient journey from the moment that they're searching for care, again, wherever that might initially be, ultimately finding the right person, booking it. But then there's actually a lot of things that can happen before that person ends up in the physical office. They can do intake, they can check eligibility, they need appointment reminders and things like that. And so being able to stitch all of that together was just not possible, without modern APIs and things like that. And so what I'm really hopeful of is that all of us who are in healthcare find ways of working together and stitching these things together, really to serve the patient better.
You told us the story about being in medical school and then being with the patient years later and realizing that it is some of those touchy-feely, soft skills that really makes a difference. But then Kyruus is obviously it's a digital health company where you're doing scheduling and you're not directly interacting with these patients, but then you have all these other acquisitions and partnerships that help serve them in different ways. So how do you keep that human aspect at the center of all of these things? Because it's obviously incredibly important to you. And when you're talking, you obviously are delivering on those things to your patients. But how do you do that when at the core, Kyruus is, you're there with, you probably have plenty of engineers and other types of technical people. So how do you merge those worlds?
Yeah, it's a number of different ways. One of them that Karen actually, who previously spoke with you, really has spearheaded was the Patient Family and Advisory Council. So we actually have a number of patients that we engage with on a regular basis. I sit with them, the whole clinical team sits with them, our product leaders come in and listen to them. And they really reflect an incredibly diverse set of experiences with healthcare, from in the rural worlds to folks that didn't have any insurance, folks that have dealt with cancer, folks that have been caregivers for other people going through healthcare. And that reminds us, I think, very clearly who it is we're serving. I think we also get it though in other ways, and I think there's a pride and a comfort that we also can work through other companies as well. And so, if there's a company that is helping and really developing a community, a virtual community for the transgender population, when that member may need now to suddenly interact with the brick and mortar healthcare for gender affirming surgery or something like that, we want to be there to support. So if we can be providing the right provider data, enabling the right schedule, it allows our partners to then really go focus on specific populations. And I think we feel some connection to that, right? That we're enabling them to be better because they can really focus on that part of the equation.
Thank you so much for being here and for this conversation. It was really fabulous.
All right. Thanks for having me.
Wonderful. Thank you, Graham.
And thank you all for watching. We'll talk to you soon. Bye-bye.